My name is Martha Herring. This is a demonstration of insertion of a Foley catheter. During this procedure, I will follow all aseptic techniques, standard aseptic techniques, and anything in particular for the patient and their condition. Prior to the procedure, I will check the order in the chart. I will gather my supplies, verify hospital policy for the procedure, and follow manufacturer recommendations for the equipment. Prior to going in to see the patient, I'm going to go ahead and clean my hands. Good morning, Mrs. Berry. My name is Martha. I'll be your nurse again today. Can you give me your full name and your date of birth? Thank you. How are you doing today? Well, the doctor's ordered us to put in a Foley catheter today to better measure your urine output. Have you ever had a catheterization? Yes, that's where they put the catheter in your bladder, and then in this case, you inflate a balloon that holds it inside, and it's attached to a bag that's going to hang at the bedside so that we can measure. It's a little different than when you had your baby and they put the catheter in and drained urine out and then pulled it immediately out. Does that make sense? Do you have any other questions? Okay, well if it's okay with you, let's go ahead and get started. I'm going to raise the bed up a little bit and bring your head down, and I'll pull down the side rail. I'm also going to pull the curtain, and I've done an assessment. She is at her baseline. It's safe to go ahead and proceed with this procedure. Before we get started, I have the supplies I brought into the room. I'm going to put on a pair of non-sterile gloves. Well, actually, before I even put on my non-sterile gloves, I'm going to get a piece of tape ready if I need that for securing the catheter. And I'm going to take this washcloth and get some nice warm water on it to do some pre-cleaning. Okay, now I have my warm washcloth. I'm going to clean my hands again. And I'm going to put on my non-sterile gloves. Okay, Ms. Berry, I'm going to need to remove the blanket. And I have a warm washcloth here. I'm just going to wipe, so I will be touching you. Wipe down, cross on the other side, and then straight down. I'll go ahead and remove my non-sterile gloves. Clean my hands again. And then prepare to do the catheterization. I'll open up the kit. I try to do this where it can easily be seen, but space is at a premium here. I'll keep my fingers in that 1/4 inch, and I'll punch out my gloves, and I'm going to put these up here so you can more readily see me put on the sterile gloves. I'm dipping my finger into the cuff. Okay. I'm going to take my first drape and I'm going to drape it on the patient. I don't need this blue drape, so I'm going to put that in the trash. And I'm going to take my second drape and place it. Now, to make this a little bit easier for viewing, I'm going to split my kit. I did check the patient's chart. She doesn't have any allergies. First thing I'm going to do is take the tubing off of here, pretty much all the way off. And I'm going to go ahead and use the hydrogen peroxide. Drip that on the cotton balls. And then I'm going to open up my lube, put that in my tray, and then take my tubing and put that in the lube. Toss. Then I want to take my syringe, and I'm just doing this to prepare. I'm not going to inflate the balloon yet. Then I'm going to take my tweezers. Now, normally you would use your non-dominant hand to hold the labia apart, but because of the angle that I'm doing this, I'm going to have to use my dominant hand. And then I'll wipe farthest from me, towards me, drop. Labia closest to me, towards me, drop. And then down the center, towards me, drop, drop. Then I'm going to take my well-lubricated catheter, and I'm going to insert. Now, obviously, this is a stuffed bear, and I cannot really insert this. But once you see urine flash back, I can hold with my dominant hand, bring up my syringe, and flush, or inflate the balloon. Once it's inflated, I can remove this, and we'll be secured. Then I can go ahead and take this drape off. And I'm going to pull this and the rest of my supplies, take off my gloves, and move those out of the way and into the trash. I do need to grab my bag before I take off with it and hang this on a non-movable part of the bed. And then we can take the rest of this. Okay, and then I'm going to clean my hands again. Put on a pair of non-sterile gloves. And secure the catheter to the patient per agency policy. Some agencies will have, or institutions will have, dressings for this, or specific dressings that are for this purpose. I'll use a piece of tape. I'm going to cover my patient. How are you doing, Mrs. Berry? Lift the bed to where she wants to be, where she's comfortable. Put up the side rails. Give her the call light. Then I will chart the procedure, date, time, any issues we had with doing the procedure, and we'll continue to monitor urine output over the course of the shift and patency of the catheter, if there's any problems with the catheter, and any problems would be reported to the charge nurse. That ends this demonstration.